Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. In this video, I'm going to share with you some tweaks or modifications to you if you are a side sleeper, but you're dealing with back, butt, or sciatica problems and you're looking for a solution because you wake up in the middle of the night or you wake up in the morning with a lot of pain, numbness, tingling, or stiffness, again, in your back, butt, or leg. And so the intent of this video is to help you sort of outline some different tests, tweaks, I call them, modifications, or experiments that you can start running, and then let me know in the comments what works for you, what helps you out. And so there's only 3 responses to any of the experiments that I'm going to run. You can either feel the same, meaning it doesn't help you. You can feel better, meaning it improves your sleep, reduces your pain, numbness, tingling, stiffness, your symptoms, whatever they are. And or maybe they make you worse. And when something makes you worse, well, the opposite of worse is something makes you better. And so you can still learn from all that. But start to run these experiments one by one. Be very scientific and systematic in the way that you do it so you feel more confident about the positions and the changes that you're putting yourself in the middle of the night. Some of these maybe will be familiar to you. Others are going to be completely outside the box, so be sure to check out the entire video. Oh, and by the way, if you're not sure as to the cause of your back, butt, or sciatica problem, feel free to download my Better Than an MRI DIY diagnostic guide. You can click the link, download that for free above. All right, so if you're watching this video, you probably identify with a certain default sleep position. Maybe you identify as a side sleeper, a back sleeper, a belly sleeper, or maybe you're just all over the place. Regardless, we're going to start by breaking down these different modifications sort of per the position. In this case, we're going to start with side sleeping, and then we'll sort of share some outside-the-box strategies regardless. And by the way, as we go throughout these tweaks or modifications, just because you think you've tried something and it hasn't worked, I just ask you stay open-minded. You go one by one through each of these tweaks, so this way we don't miss anything and you don't miss collecting valuable information that could help you out. All right, so if you're a side sleeper, very common thing that maybe you've seen before, so we'll start with sort of the maybe obvious tweaks, is have you tried sleeping with a pillow between your knees? All right, so if you have a million pillows like most people, and or you're someone who's dealt with back, butt, or sciatica problems, you probably have a whole closet of pillows and wedges, so just try this out. So first, starting with the pillow in between the knees. And the reason that sometimes this is valuable for people is because, if I take this out, lots of folks end up having their leg fall across. They end up in a really twisted position. And so if you can prevent that yucky motion, it may be yucky, it may not be yucky, but again, if your leg falls across your body, then what you're doing is you're placing tension through this irritated buttock muscle, piriformis, potentially causing some irritation or twisting of the joints in the spine, as well as creating tension on a sensitive sciatic nerve if you have leg pain, numbness, or tingling. So by putting the pillow between your knees, sort of blocks that motion. All right, so that's the first one. Give that a try. Another thing you might want to consider is not putting the pillow between the knees, but putting the pillow between the ankles. All right, and so the reason that this is helpful is because one of the yuckiest motions for people with back, butt, or sciatic problems is sort of this figure 4 motion. All right, so where you kind of bring your leg up like this, and you may have even seen this stretch. You may be doing something like this on your back. Pigeon poses, figure 4 stretches, piriformis stretches, whatever you want to call it, hip openers. All right, but lots of people have pain when they open up their hip. So what if we close down on the hip? The opposite of this is this. All right, and so if we do this and we jack the ankles up and we let the knees collapse together, then we're sort of doing the opposite of that figure 4 or yucky motion. Now, one pillow might not be enough. You might need 2 pillows, and maybe that's another tip for you. If you find that putting the pillow between the knees helps you out and reduces the amount of time that you're waking up in the middle of the night, improves your comfort throughout the night, improves how you feel first thing in the morning, then why not live on the extremes a little bit? Why not try 2 pillows? So again, if this feels okay, then you could keep it like that. But maybe what would feel even better is a huge pillow. Stick this sucker between there, and now maybe you have 2 pillows right in that position, and maybe that's even better. If 1 pillow is good, maybe 2 pillows is even better. And so you can get creative with this. I'm just giving you some ideas because many people come to me and say, I've tried everything. Well, maybe you haven't run these tests, number 1, very scientifically, meaning one by one, and maybe you haven't taken them to the extremes enough and kind of had a process that you can check the boxes off to feel really confident about, hey, I've tried all those things. I've tried to optimize my sleep position. I watched Dr. Charlie's videos. I went step by step. And you know what? those didn't work, or they did work, right? And here's what I found. Imagine you could hand a sheet of paper to your provider, your PT, your doctor, your surgeon, whoever, and said, I tried, 17 or 20 of these different tweaks for sleeping, and here were the results, right? How valuable or helpful would that be? It'll be very helpful for me, and I think it'll be helpful for someone else too. All right, so far, we've got the between the knees. We've also got between the ankles with 1 or 2 pillows. All right, and then the most obvious next one, so we'll call it tweak number 3, I guess, would be the combo of them both. Now, you might need a bigger pillow or something like that, but a body pillow works okay. But putting the pillow between your ankles and between your knees tends to keep things kind of more symmetrical because things are pretty well stacked. You're not having a lot of rotation. You just do it between the knees. You tend to rotate your hips. And so if you put it between both, that is something to consider. Both the knees and the ankles, a combined approach sometimes works best for people with these issues. All right, so the next tweak for sleeping that most people who are side sleepers do not consider is putting something to, quote unquote, fill in the gap underneath their side. So you can try this on the right side and the left side. So you can break it down into 2 different tests. But here's often what happens. What happens is if you lay on your side, and males tend to have wider shoulders, females tend to have wider hips. Regardless, what happens is your hip bones hit the surface and your shoulders hit the surface. Right? So you've got these 2 uprights that contact the surface, and then your trunk kind of just sags. Picture like a suspension bridge. All right, so in this case, she's in a relative side bend to the right. Can you crunch up there?
Oh, sure.
Exaggerate? Yeah, you're in a relative side bend to the right. If you picture that, well, again, the hips are there, the shoulders are there, and because of gravity, the spine sags to meet the surface. And so you can imagine that if bending to the right is yucky and causes you pain, well, then when she's laying on her left side, she's sort of bent to the right, if you think about it, all right? And so what you can do is you can kind of lift up or jack up the center of her spine underneath her rib cage. This is just like a folded up towel, so you can get a beach towel, a regular towel. You can also just get like a really thin pillow. Oftentimes you don't need a thick pillow, but you could give it a try. So space between the top of the hips and the ribs, and you jam it under there. Go ahead. And it provides like a nice little cushion.
It does.
Like a torso taco, all right? I had that in my inventions book, all right? But either way, now she's in less of a side bend because it blocks her, essentially, from that spine and the gravity just causing her to sway towards the bed, all right? And obviously you could try this on the other side, same effect. Now, one thing too that I want to sort of alert you to is that many people come to me and say, well, I have pain on the right side. So that means that this won't work on the right side because I'm laying on my right side. And they have this belief that it's caused by compression or pressure on their hips. Try it out. You've got nothing to lose. And so I don't care where your symptoms are. You might actually do better laying on the painful side than laying on the not so painful side. So try to set any beliefs you have about what will work or what won't work, or what you've been led to believe is best for you, and just try these things out. Look at the data objectively, try to remove the emotion, and then give me your feedback in the comments. All right, so we've got the sort of torso taco, this little jack up, this little towel folded, stuffed under there, as well as maybe a thin pillow. All right, so try this on the right and the left side. Now, maybe I should have started this, but a super obvious thing to try, and I mean that in the nicest of ways, but if you haven't tried it, it could be because you're just glued to doing and kind of habitually sleeping in one position, is just to sleep on the other side. So again, regardless of the location of pain, maybe you're a habitual right side sleeper, not as in this case. I looked at you and for some reason thought you were sleeping on the right side, but you're not.
I'm on my left.
Oh, you're on your left. Maybe you're a habitual left side sleeper, and it might be as easy as just switching to the right side. Now, here's the thing. These things are habits, and when you're sleeping, by the way, positions are often the last thing that I recommend people change when they're trying to improve their sleep. But nonetheless, you're not generally all that aware when you're sleeping. And so you might actually require some type of like external cue or something to help sort of retrain the way that you're positioning yourself or sleeping, especially if you've been sleeping on one side for years. Potentially you've been sleeping like this because your hubs or your partner or your dog or your cat or whatever else is on the other side of the bed, right, sleeps there. And you've just always slept on this side of the bed in this way. And that's just what you do. So what you could do is, let's just say that somebody is on that side of the bed and they don't want to move. And that's why you face this way, let's just say. What you could do is I could say, hey, why don't you try putting your head down the other end. Put your head down the other end. Cool. Now, hopefully your feet don't stink because that person might not like you. But if you put your head down the other end, so put your head at the foot of the bed, all right, gives you a little bit of a different experience. And now she's sleeping on her right side. So maybe she doesn't want to roll towards that person because they have bad breath or whatever else is going on, or they snore or something like that. All right, but this might work. And it might allow you to more naturally just sort of fall into this position and help you retrain the way that you sleep. So that's one option. Another option is, let's just say you have nobody on that side of the bed, is you could try switching total sides of the bed. So just moving to the other side of the bed, and for whatever reason, maybe it makes it easier to retrain the side that you're sleeping on. And the final thing you can do to help retrain the side that you sleep on is push the bed to the wall. And while you may have an absolutely enormous bed and maybe this doesn't matter, I just found that most people don't really care to face the wall, whether they bang their knees when they roll over or something like that. And so what you can do is kind of box yourself in a little bit of that, and sort of subconsciously train yourself to roll onto the other side. All right, so some things to consider. Again, just switching. If you have pain sleeping on the right, try sleep on the left. If you have pain sleeping on the left, try sleeping on the right, and you can retrain it a few different ways. All right, so now for some outside-the-box tweaks or modifications that you probably never thought of and nobody ever showed you, but I'm about to now. So you see this thing here. It's a sleeping bag. So I'll share with you the intent of that in a moment. But keep in mind that most people with back, butt, or sciatica problems have some yucky motions, some motions that reproduce their pain, numbness, or tingling. And they show up a lot of times sort of subconsciously, or while people are sleeping, if you want to call it that, in the positions that they place themselves in the middle of the night when they're not aware of it. And so they're baking that yuckiness into their sleeping positions. They're not aware of it. And then they wonder why, or you wonder why you wake up in the middle of the night, you can't sleep, or you wake up and you feel more pain. So some of the common yucky motions for people with back, piriformis, sciatica issues is this figure 4 motion. So maybe you do this motion, you feel some type of pain in the back, butt, or running down the leg. Or another one is this knee to chest motion, pulling it up. All right? And a final one is this leg raise position where you stretch the sciatic nerve, you feel a lot of tension through here. Maybe again, numbness, tingling is reproduced. If you have any of those yucky motions, even if you don't, I would give this sleeping bag hack or trick a try. Now, why a sleeping bag? Because again, when you're sleeping, you're often not aware of the positions you're placing yourself in. So aside from having somebody be there to move your legs in certain positions or prevent you from doing so, which would just be weird, why not have something do it for you? And so if you have a sleeping bag that kind of keeps you nice and snuggled in, or nice and kind of confined, then it can help you prevent some of these funky positions that you place yourself in without you having to do any of the mental work, right? Because you're not awake anyway. So let's talk about a couple different things you can try. So lay on down. And we talked about earlier in this video using a pillow between your knees and or between the ankles. So knees only, ankles only, or between both. But maybe the pillow falls out, right? We all have that experience where we're like, well, Charlie, great idea, but when I wake up, the pillow's on the floor or across the bed or something like that. And so why not zip it up? So what you can do, take the same idea, apply any of these tweaks we talked about earlier, just like this. And then what you can do is you can wrap yourself up. All right. Now, I'm not going to lie. This sleeping bag is pretty old. And so it's fairly loose, right? And the chance that she's going to very easily just fall out of position, well, it's there, again, because this is a pretty big sleeping bag. I don't know who needs a sleeping bag that's this big. All right. Probably wouldn't keep you very snuggled in. But regardless, you get the concept. All right, so number one, her pillow is not going to fly out anywhere. If anything, it'll move a little bit, but it still kind of maintains its position. And again, it prevents her from doing all kinds of wiggling. So if she tries to let her leg stretch out in front of her, she can only go so far because she kicks the sleeping bag. All right, so that's one way that it might prevent you from falling into that leg crossed over, kind of figure 4 yucky position, which puts tension on the back, butt, and sciatic nerve. Now, this is also useful, sleeping bag trick, in preventing you from falling into a leg raise. So I once worked with a guy who he slept with his leg completely sprawled out. He would do this. That's just the way that he slept. His leg would dangle off. And what is this? This is a leg raise in disguise. And so he would be putting his sciatic nerve on tension all throughout the night. What does this do? It stretches it. When you stretch something, you reduce blood supply to it. Why do we care? Because blood carries oxygen and nutrients. So if you stretch something too long, you reduce the blood supply and oxygen to that tissue. And if it's an angry nerve, it's not going to like that. So we do this, pillow or not, and we zip her back up. And now I say, go ahead and try to do that, right? Try to fall into that very habitual leg raise while you're sleeping, and she cannot, all right? And so this is kind of cool because, again, habits are hard to break, especially when you're not awake, all right? And so this is helpful because it would prevent her leg from falling across the body or off the bed and may help reduce that strain throughout the night. Another thing, right? So revealing the yucky motion, all right? Here she is. She's got the pillow between her knees and her ankles. But like I said, a knee to chest is often yucky. And sometimes people sleep in this fetal position like this. And I think she does this because I've woken up and seen you like this. All right. And so at that point, it's like, all right, well, this just fell out of place. What do we do? Well, what if we could put something here? All right. And what if I didn't have to wake up in the middle of the night and pry her legs open like that? All right. Well, what you could do, my daughter has like 10 of these. All right. These little squishmallows. It could be a little bean bag. It could be a bunch of pillows. Now, you would get hot, all right? So disclaimer, put on a fan or turn down the air, something like that. But you could put this right here, all right? Now, she could, right? If she really forced it, she could pull her knees up. But there's a lot of resistance to that, all right? And so she could do this. If her knee to chest is the yucky thing, she can jam something in there as a block to prevent that motion. And now, in the middle of the night, when she habitually wants to pull her knees to her chest, guess what? She can't do it, all right? And if she can't do it, that means she can't place herself in that yucky position, and potentially preventing that could allow her to sleep with less pain. So you see how this is kind of nice because it creates sort of this controlled environment where you can block certain motions, you can maintain certain positions without you having to really be aware of it. And so it can sort of help you in retraining the way that you sleep or any sort of quote unquote bad habits that you might have. So that's the sleeping bag hack. If you're side sleeping, these are maybe multiple ways that you could use it. Try it on, let me know your thoughts. All right, so the final thing you want to try is maybe a weighted blanket. Now, look, I'm being a little silly because I would never recommend, disclaimer, that you just put weights on yourself in the middle of the night. But this is all we had, okay? So a weighted blanket or towel in this case, all right? So again, if you don't have a sleeping bag, that's fine. You can try a weighted blanket. Sometimes this provides a little bit of, again, security, comfort, makes you feel a bit more safe, right? And again, it can kind of, with a little bit of load on the body, prevent you maybe from falling into those habitual patterns that cause you symptoms. All right, so we talked a lot about positional or body tweaks modifications for you if you're a side sleeper. But what about the psychology of pain? And how can you change your psychological state and sort of reposition the focus and or safety of your mind while you're sleeping, right? And so again, pain is an experience both the brain and the body being the different mechanical stresses that you place on the joints and the nerves and muscles and whatnot. But psychologically, what if we could instill a better sense of safety and or more relaxation within the system when we sleep and when we're sleeping on our side? So something you can do, I live by these things, you can just maybe try wearing earplugs. So maybe you have some little noises that go on in your house, right? Maybe you have a baby. Now, don't ignore the baby, all right? But maybe you have somebody else who's sort of taking shift, right, to take care of that child, and you want to get some sound sleep. So you could try putting earplugs in, maybe headphones, something like that. So earplug tweak, all right? More quiet, right? Now, the next thing that you could do is you could try modifying the amount of light in the room. So if you have maybe a bedroom that faces and the sun pours in first thing in the morning, right? Or the moon is really bright and it's shining in, maybe you try getting some different blinds or putting a temporary towel or blanket or something over the window, right? To see if darkening the room or changing your environment, the light, if you will, that's let into the room changes your quality of sleep. A final tweak that you may want to consider to make yourself more psychologically safe or place you more at ease is to just change the environment completely, change the room that you sleep in. Obviously, it's going to change other elements such as the surface and things like that. But again, just positioning yourself in a totally different environment, not physically, but well, I guess physically, but also psychologically, right? And so we've been in the same room, same bed the entire time, but maybe if you have an office next door, maybe you try sleeping in that. Or maybe that's more stressful for you because you work out of that office. Or maybe you associate your living room and the couch there, or a pull-out bed with better times, right? More social engagement, and you feel more at ease doing that. Maybe sleeping in your daughter's bed or your son's bed or someone else's bed, right, is associated with bad juju or makes you miss them and you feel upset about that. Regardless, the idea is just change the environment. Pick a different place in your house that maybe is more psychologically less stressful, puts you more at ease, and makes you feel more safe for your sleeping experience. So just something to try. All right, so hopefully this video with these side sleeping tweaks was valuable, maybe eye-opening for you, and allowed you to try some things that maybe you would not have considered. Again, let me know in the comments what your response to these tweaks were. And by the way, we work with people all around the world dealing with back, butt, or sciatica problems. So regardless if you found something that was helpful, there's so much more that you could learn. Maybe you didn't find something that was helpful. It doesn't mean that there's not an option or a sleeping tweak that might help you that maybe, again, you didn't consider. So just click the link below if you're looking to heal as quickly as possible and as naturally as possible. Again, we work with folks all around the world. Click the link below to apply to work with us, and then follow instructions to submit a detailed case review where I'll review your case personally. Thanks so much for watching. Chat soon.